It's a matter of the AIDS paradox. At the beginning of the epidemic in 1984 or thereabouts, people thought the way to deal with it was to lock people up who had HIV and to discriminate against them and cut them off. But it was found that there wasn't enough barbed wire, and in any case, that the best way to tackle this pandemic was to reach out, bring the messages of healthcare, and thereby to protect people who are vulnerable, and thereby to protect the community. And in countries that did that, their rates fell. In countries that didn't or wouldn't do it, their rates went up. Well, a law that is not helpful is a law that criminalises the communities that are most at risk. The communities that are most at risk are men who have sex with men, gay men, and people who inject drugs, sex workers, and others, prisoners and people in detention. These are the groups that are most at risk, and laws that impose limitations on them and stigmatise them, make them hate themselves, are going to be impediments to their getting the messages of healthcare, care for themselves, and thereby care for their sexual partners. Anti-discrimination laws are important because they give people a feeling of self-respect and that they should listen to the messages about healthcare, and the messages tend to get into their head. Getting people to comply with the law, take it from me as somebody who was a judge for 35 years, is not always easy. And getting into their heads the message about the risks of HIV and their need to protect themselves is a paradox. They've got to be helped in order to help. They've got to be assisted, and the law must assist them in order that they won't hate themselves and thereby get infected and infect others. Well, the judiciary has the obligation to interpret the law. There are often opportunities for judges to go one way or the other in the interpretation of the law. And I think in the early days of HIV, an effort was made to inform judges about the AIDS paradox and inform judges about the idea that just locking people up is not going to really work. There are just too many people, millions of people infected with HIV, and that therefore the strategy should be to reach out, to get into the minds of people so that they know they have to be careful for themselves, they have to protect themselves from getting infected, and thereby they will protect their sexual partners and the community as a whole. And that really is the HIV paradox. It's a hard message to get across, but the countries that followed the paradox did well, and the countries that didn't follow it did poorly in the response to the HIV pandemic. Well, I should make it clear that I myself am an LGBT person. I'm a gay person, and quite early in the pandemic I was open about it. Now, that wasn't what you were supposed to do in Australia. If you were gay, you were supposed to be very, very quiet and very ashamed of yourself. But I think it was actually very good. It was good for my colleagues in the courts. It was good for others in the community, and I think it helps to normalise. You can hate people if you don't know them or if you think you don't know them, but if you know who they are, it's more difficult to hate them. And I think it's a pity that there are still many people who can't, or feel they can't be open. And in some societies there is a very high level of punishment. So this is a real quandary for societies that want to reduce their infection, but also want to become more modern in the way they approach the dignity of every person to live their life with decency and dignity and not to be oppressed. In this conference in Bangkok, there was a wonderful session when a man who was blind talked about the problem of having sexual reproductive rights and sexual health for blind people. And he made the point, people don't do as you tell them, they do like you do. People are the same as you. And that's true of LGBT people, it's true of sex workers, it's true of injecting drug users, and that's a lesson we have to learn not just for HIV, but for a kinder and more inclusive society. Well, if you can get the health minister and the shadow health minister, and if they are enlightened and have read the literature and know what works and what doesn't work, then you can make real progress. But I don't count on that being possible in many countries, not in the short run anyway. And so that's where UNAIDS is so important. UNAIDS brings the messages that were really taught in the very beginning of the AIDS pandemic by a very great international civil servant, Jonathan Mann, who was the head of the Global Program on AIDS. He taught the AIDS paradox. He taught reaching out and engaging with people, and countries that took his advice have done well, and countries that didn't take his advice have not done so well. So the lesson was right back in 1984. It is right today, and it will be right in the future, and it'll be right for other pandemics, to involve the people who are affected, to engage them in the strategies, and to spread the science, good science, throughout the world to the key decision makers. Well, if you need to change the law, and often we have to change the law, laws on homosexuals, laws on injecting drug users, laws on sex workers, it's a difficult job, and societies tend to be conservative. Sometimes it's necessary to go to the courts because parliaments are worried about getting re-elected and worried about taking brave steps, and therefore parliaments sometimes fail. But the courts have actually been, in many countries, very important protectors of civil rights. I know from my own life as a judge over many years, including in a final court, I know how important courts are in defending minorities. Courts march to a different drum. They don't march to the drum of what's popular. They march to the drum of what is right. And that's what judges should do within the law, and that's what judges have done in respect of LGBT issues and in respect of HIV issues. Not always, but it's been a story with many heroes, and the UN and UNAIDS have played a very important role in educating judges and educating other lawmakers in society. To make it impact on people's lives, you have to move it out of the statute books or out of the law books. The statute books contain the acts of Parliament. The law books contain the opinions of the judges and the orders of the judges. But that doesn't often self-execute. That doesn't change behaviour in society. It doesn't change prejudice in society. And therefore we have to find ways to get community leaders, community groups, civil society organisations and brave people to speak out. And that can be done and it can be effective. But you can't just leave it in the books. It's got to be translated into action, and to do that you need civil society organisations who will take the messages, who will make a lot of fuss and get the attention of the politicians and the attention of the judiciary and lawyers, and that way we can make a law, a system that is both more respective of others and, in the matter of pandemics, more effective in saving lives.